Hi, everyone. Thank you so much for watching our quick little video here about pediatric opportunities here in the DPT curriculum at Northwestern. I'm Jessica Trenkle, and I'm an associated faculty here in the program.
Hi, I'm Colleen Peyton. I'm one of the assistant professors here at Northwestern, also in the pediatric curriculum.
Wonderful. So we're going to start just talking a little bit about how pediatrics is woven into the curriculum here at PTHMS, and then we're going to go into some opportunities in terms of research and specific course selection if you have an interest in pediatrics. There we go. All right. So you can find instances of pediatric information shared throughout the curriculum in many of the core classes, not just in the pediatric specific courses. So even in the first semester, your first year, there are opportunities to learn about pediatric assessment measures, about evaluation tools and interventions in the form of case studies in the Intro to Clinical Decision-Making course. As you go through the curriculum in the neurologic coursework and in the musculoskeletal courses, there are many opportunities to learn about specific diagnoses, specific tools and outcome measures that we use in pediatrics, as well as specific interventions. So looking more specifically at courses where pediatrics has a large focus, first is in our lifespan course, which occurs in the fall of your second year. And this course really looks at the development of a child from infancy all the way through adolescence. In the winter of your second year, then the following semester after lifespan, there is the opportunity for experiential learning in the course Neurologic Dysfunction 3. And in this course, students and learners have the opportunity to choose a track where you meet with a family and a child who has a need for ongoing physical therapy. And there you have the opportunity to do assessment measures and evaluations and interventions with that child and their family. And lastly, in complex patients, which occurs in the spring, summer of your beginning of your third year, there's the opportunity to choose a course where the focus is on pediatrics, and we'll talk a little bit more about that. So in lifespan, this is again in that fall of your second year, this course is really where we really dive into the development in infancy and throughout childhood. So right away in the beginning of the semester, what we start with is focusing on how do children go from the position they are in infancy, where they're very flexed, they have spontaneous movements, but not a lot of purposeful directed movements, to the point where they're running and jumping and climbing stairs. You know, what muscles are being strengthened, what balance reactions are developing, and what range of motion are the infants gaining in order to be able to achieve the next skills. So this is done not only through lecture, of course, but also through a lot of small group lab opportunities where we bring in community members, they bring their infants and their children, and we're able to really observe and learn about development through that lens. So the first lab that occurs is one with infants under 12 months, where we have small groups just observing the movements that the children are doing. So how is this infant starting to roll? How are they beginning to sit? What muscles have they strengthened to get there? And what are the skills that we would expect them to be doing in the next couple of months? From there, we move on to our toddler lab, where we have a little bit older children come in and just take over the classroom space on the 7th floor. And here we're observing them running and jumping, walking, climbing stairs. We're talking about how their gait pattern has developed, how they've gained eccentric control of their muscle groups, balance in a variety of ways, just really looking at the continuation of development in this age frame. Not only in this course do we focus on the development of activities or motor skills, but we're also looking at the development from an orthopedic lens. So here we have an example of one great lab that we do where we're looking at how the hip joint develops, how the torsion, the tibia, and the foot develops from a time when a child is non-weight bearing to a time when they are more regularly weight bearing. And here we see we have many models of bones that have been developed in the department to help all the learners kind of see how the bones go from one position from when a child is in infancy to a more mature position. Another great opportunity in the lifespan course is an opportunity to work with families and with caregivers of children who have had physical therapy either in infancy or in childhood. And so in this parent panel, we talk to families about their experiences with physical therapy, about what advice they would give to new clinicians who are working with children and families. It's a really wonderful opportunity to really kind of bring us back to thinking about families' goals, their beliefs, their wants, and their needs. And so as we go later into the semester, thinking about diagnoses, and in the following semester, thinking about interventions, it really helps guide us to making sure that our care is family-centered. The next course we're going to talk about is complex patients, which again occurs spring, summer, at the beginning of your third year at Northwestern. So complex patients, there are opportunities to choose a track where you have more exposure to pediatric patients and their families. So one of at least my favorite opportunities is the Go Baby Go opportunity in complex patients. And what we do here is we have families come in with their children who have some sort of mobility challenge. So many times these children maybe aren't walking, aren't standing independently, though they have peers or siblings that are moving around in that way. We do assessments on these children, and we talk to the families about their goals for their child. How would they like their child to be able to get around and to move independently and freely? From there, what we do is we take off the shelf motorized cars, so like the little ride-on cars that you would get at Walmart or Target, and we modify those cars so that the children that came in for the assessments can use them as a means to explore their environment. So sometimes the modifications we make include adding head support or adding seating support for the children if the lap belt just isn't quite enough support for them to sit. Another big modification we do is changing the way that the car drives. So many of the cars have a foot pedal for on and off, and we change that so that there's a button on the steering wheel that requires just real light touch. And if the child touches it, then they're able to drive the car forwards. And when they remove their hand, then the car stops. And what we know from the literature and the research on mobility is that independent and autonomous mobility is really important for children to develop cognitive skills, to develop problem solving and socialization. And so that even if children aren't walking as their primary means of mobility, they still make gains in these other domains if they have a means to get around. And so the little Go Baby Go cars really provide that opportunity for a lot of our families. And it's just a really fun course. We have a really great time doing it. Let's see, in that same course, there is also the option to elect a pediatric case. And in that section, then you're going to learn even more about pediatric interventions, about evidence-based treatment strategies, and diagnoses. So another opportunity for you to choose to engage a little bit more into pediatric research, if that's what you're interested in.
Okay, so I'm going to talk a little bit about the kinds of research that we do at PTHMS and opportunities for synthesis. So the synthesis in the fall of your first year, you can kind of get an idea of what projects we have going on at different times, which vary from year to year based on sort of what we're doing research on, that you can be a part of for the half of your first year and the second half of your second year. So that's been a fun thing that spans over 2 of your years at PTHMS. And I'm just going to talk about some of the kinds of things that we do. So the work that we do, we assess motor behavior from infancy to adolescence across all of the different teams that we work with. So we work with preterm infants, we've worked with infants and toddlers, school-age children and adolescents, and parents too. I should put them in there as well. So those are the kind of subjects that we have. And, a lot of us that are on the PEDS faculty have been clinicians in a hospital or home-based services or school-based services. So we bring to that our clinical expertise, but some of our research is conducted in the NICU, where we're working with babies while they're still hospitalized, or neonatal intensive care unit is what NICU stands for. Sometimes the parents collect the data. So this is a smartphone app where parents would take videos of their babies moving. And we looked at which regions of Chicago were they able to send us data from. And they sent us data from all over Chicago and Cook County, where Chicago's located. So that was a fun one that we still are involved in. We look at movement analysis in a kinematics lab, like a gait lab, but for babies. And we're learning how to capture data without having to touch the baby. And hopefully, eventually, we can translate this to just one camera here. So there's not so many cameras needed so that families could send us data from home that we could transfer into sort of more complex joint motions. And this is taken at the Ability Lab, the Shirley Ryan Ability Lab down the street, where we also partner for both research and teaching. We also look at cognitive and motor outcomes in toddlers. So this child is doing some motor activities and some cognitive testing between the ages of 1 and 3. And a lot of times we'll follow these kids over time as well. We also do things with adolescents, and this is in a park. This is called a frame runner. So the kids who have mobility challenges are able to participate in running groups and things like that. And that's been really fun as well. So we talk a lot about participation in adolescence and running and things like that. And then we've been doing some longitudinal studies where we follow the same baby from the NICU or right after the NICU from the first few weeks of life all the way into adolescence. And that's been really fun too. So a lot of our clinical samples that we started as clinicians and we continue to follow them into research. So we really are sort of mirroring what we do in research with what we teach in the program, and even including some of that information as we learn it real time. But we're studying all the same things that we're teaching, which is fun. So we all have some expertise in all the areas that we talk about in lifespan and throughout the curriculum. And that's about it. We're always doing new projects, so it's a little bit hard to exactly say what will be there when you're thinking about coming to school. But I think that it's pretty safe to say we do a lot of different work in research in kids from infancy to adolescence on different kinds of topics. But there's always something going on. So please feel free to email with us if you have any additional questions about the pediatric curriculum or anything else at Northwestern that we can help you with. And thanks for considering us and for your interest in pediatrics and for watching this with us.